Hi, I'm Dr. Frank Garcia with the San Antonio Orthopedic Group, and if you've looked at the site that we created looking at knee replacement surgery, you're here to maybe get a distinction between a full knee replacement versus a partial knee replacement. Obviously, you may be searching as you may be a candidate for either one, and hopefully we'll be able to highlight some of the distinctions and differences about this. In the category of knee replacement surgery, the standard has been and still is full knee replacement surgery. And the patient typically is an older patient with a degenerative process that has been going on for some period of time, or maybe an inflammatory condition such as rheumatoid arthritis. Either way, the patient, based on examination and imaging and so forth, is found to have arthritic changes throughout the entire aspect of the knee, where a full knee replacement has to be done. In that case, as this model would show, you'd have arthritis throughout both sides of the knee and also involving the patellofemoral joint. That patient typically, again, has issues with joint stiffness throughout, swelling diffusely in all areas, and the patient may have failed measures of conservative treatment. The hospitalization and the process of full knee replacement is about 3 days, and the recovery is probably about 2 months in the making. Now, there are some differences, but most patients fall into that category. The patient who has arthritis in one part of the knee, not diffusely, may be a candidate for a partial replacement. And typically that's a younger patient. The patient has had a previous procedure possibly, or a fracture, or some sort of post-traumatic condition where they've lost part of the cartilage in one area of the knee. Also, but not all the time, we'll have a patient who has a varus deformity or angular deformity that seems to be putting more pressure on one side than the other, and that patient would be a candidate for a partial replacement. And again, that's distinguished at the time of evaluation, and radiographically can also make that distinction. And that patient can have such a procedure in an outpatient setting, possibly a short stay, 23-hour observation setting, and the recovery is much shorter. As such, the procedure itself is done through a smaller incision. You're not really affecting the entire knee, just aspects of the knee that may determine whether it's medial or lateral, the recovery period of time. But more typical, it's about 2 weeks or so. The patients feel more like their normal knee. I've had patients with both a knee replacement on one side and a partial on the other, and they do tend to prefer that. Obviously, that determination, that clinical decision as to whether it's a full knee replacement versus a partial replacement, is based on the history, is based on the examination and radiographic studies. If you think you're a candidate for either one, speak with your orthopedic surgeon and ask those questions as to whether a full replacement or a partial replacement may be the right procedure for you.